From the campus of the University of Kentucky, this is Behind the Blue. I'm Cody Kaiser with UK Strategic Communications. UK Healthcare is an academic health system made up of the University of Kentucky's hospitals and clinics. About 9,000 team members, more than 80 specialized clinics, and 140 plus outreach programs. In fiscal year 2023 alone, it served Kentuckians through roughly 1.4 million outpatient visits. Suffice it to say, UK healthcare is a driver for positive healthcare outcomes in the Commonwealth. On this week's episode, we're bringing you another installment of The Business of UK, a special feature hosted by Dr. Eric Monday, the university's Executive Vice President for Finance and Administration and Co-Executive Vice President for Health Administration. Dr. Monday sits down with Craig Collins, Senior Vice President and Chief Financial Officer of UK Healthcare and CEO of Beyond Blue, the affiliated organization that helps support and expand UK's work across the Commonwealth. Together, they break down what Beyond Blue is, why it exists, and how major initiatives like Project Blue Connect and Integrate Blue are designed to strengthen systems, reduce risk, improve security, and ultimately help UK healthcare serve more patients closer to home. And now, here's Eric Monday with Craig Collins.
Thanks again for joining us on this installment of The Business of UK. I'm Eric Monday, and joining me today is Craig Collins, our CEO of Beyond Blue, as well as our Senior Vice President and CFO of UK Healthcare. Craig, welcome. Glad to have you.
Well, thanks, Eric. I'm glad to be here.
So, Craig, before we dive into some business questions, and the point of the Business of UK is to kind of dig a little deeper, right? This is part of Beyond the Blue, a longstanding podcast series that Cody and a number of our professionals put on here at the university. But this is trying to really kind of dig in a little bit more, spend a few more minutes talking about things that we're doing here at the institution and what they mean, and a little bit of the why, the how, the what. But before we dive into that, can you talk a little bit about your background and, you know, how long you've been at UK and what you're doing now?
Sure, Eric. I'd be happy to. I'm an Iowa boy. Grew up there in the Midwest, but started my career in construction, to be honest, and worked in the construction industry for about 10 years. And then I had an opportunity to work at the Mayo Clinic. And I spent 25 years at Mayo Clinic. And during that time frame, I had numerous roles across that organization in finance, but ended up my career in starting their shared services around the revenue cycle there, and was the Midwest CFO. So with that, I was able to move from there and come to UK about 10 years ago. And since then, I've been enjoying the opportunity to live in the mission here, which is really what brought me here. It's so great to be able to every day feel what we do with the patients we serve, but then with the organization of being an academic medical center and all those things that go with that of bringing the entire mission of the university to it. So appreciate being here.
I'm glad you're here. And so I mentioned in the opening that you came here as the Senior Vice President, CFO. You get us on solid financial footing. We've had a tremendous decade, if you will, that I think builds on 15 or so years before that with Dr. Karf and just great leadership and tied to that mission. And then in the last year or so, you've taken on the additional role of CEO of Beyond Blue. And let's start to kind of peel back the onion. What is Beyond Blue? Tell us a little bit about that.
All right. So Beyond Blue was actually created in 2013, and it was created exactly for what we're doing today. It was formatted as an affiliated not-for-profit corporation. It now serves as the holding company for two of our recent acquisitions or member substitutions with the healthcare organization. That would be UK King's Daughters in Ashland, Kentucky, also known as Royal Blue Health, and then also UK St. Clair, or Clair Blue Health in Moorhead, Kentucky. It also is the home for Insure Blue and for Champions Blue. Just recently, back in June, when the board of trustees actually helped us stand up that new affiliated corporation. It, as an organization, Beyond Blue abides by all the public entity rules and all the laws and all of the things that apply to us as an academic organization within the Commonwealth. The board approves all our strategies, that approves our budgets and our investments. But it allows leaders like myself and others within those organizations to have some separation and some distinctiveness so that we can really focus on the business, which is what we're all about. That's really why we have the affiliate activities. The Board of Trustees maintains all of the oversight and the policy making for Beyond Blue, and actually appoints all the Beyond Blue Board of directors and directors for all of those other organizations that we serve beneath it.
So we like this little whiteboard, Craig. We use this a little bit. So, I mean, you got Beyond Blue here. You talked about Royal Blue, Claire Blue, Insure Blue, Champions Blue, and then, question mark future. Yep. Right. I think we can talk about that here in a moment. But so Royal Blue, this is King's Daughters.
King's Daughters.
Okay. This is St. Clair. So this is Ashland and the surrounding areas. Some of this goes into Ohio. Mm-hmm. Right. Claire Blue's Moorhead. Insure Blue. Why don't you talk a little bit about Insure Blue?
Sure. So Insure Blue was formerly known and was a part of actually King's Daughters. When we acquired them, it was known as Integrate Health Insurance Ltd. It also is an affiliated corporation, just like all the others we talked about. Insure Blue really is there to address the needs, our insurance needs for both for UK and for our employees. So UK as a business and our employees as they work underneath that umbrella.
All right. And so we have Insure Blue and then Champions Blue. What's Champions Blue?
Sure. Champions Blue, it again is a nonprofit public entity, and it serves as a holding company for our UK athletics activities. The model is really a similar approach to what we've done with the two hospitals. Ultimately, though, Champions Blue is under the same governance as the university. It's governed under our board of trustees. The creation of the holding company lets us allows for some policies and some different programmatic activities that we could do, and brings the opportunity for us to have some outside expertise to the organization. So by doing that, we have some external board members on that board that helps us really bring the business sense of athletics from corporate and from other areas to the table so that we can use that, and creates then the incentive for us to really learn how we can conceptualize different ways to raise revenues to support the athletic activities, and also so we can focus on some efficiencies that have been learned in the industry and apply them to our athletics operations.
So I think there's a couple principles that are important in what you shared about Beyond Blue. It's been in place a little bit more than a decade, and it has grown as the needs of the institution are grown. So that's one. Number two, it is within the role and scope of the university. So the board of trustees is at the top, if you will, and I'm going to put this down on the little whiteboard here to make sure that's clear, is that they are approving, everything from the members. So we got the board of trustees here at the top. That's important. You got the president, obviously, then you get to Beyond Blue. So I think that's an important consideration. So two, the board. Three, the members of Royal Blue or Claire Blue or Insure Blue or Champions Blue or something in the future is approved at the board level. The next thing I would say is this idea of expertise. And if anyone can understand expertise, I think it's a higher education institution, right? I mean, we hone people in their expertise, right? They're a great X type of physician. They're a great X type of English professor or Y type of business professor, if you will. And so on all of these, are there community members or experts on all of these boards?
There are. And that's really one of the beauties of this, is that we were able to maintain, as we brought on the 2 healthcare organizations, we maintain many of their existing board members, so that we have kind of a 50-50 or 51-49 type of a representation within those boards. But that brings home the culture of that community and of the whole environment there for the organization to maintain.
And so, to your point, Mr. Jones is the chair, who is a community member of King's Daughters Board before member substitution. Mr. Redwine is the chair of the Clear Blue, same concept. You have Insure Blue, that's our general counsel, Bill Throw. And then Champions Blue is the president. President of the university is actually the one who facilitates that board as a governor. And do you think if we do, and I think the answer is yes, we will be doing other blues, if you will we follow that same model, do you think, as we think about those board constructs?
Absolutely. I mean, I think it's what works. It's the way you connect to the community. It's the way you connect to the culture, and you continue to grow that experience for the communities that we serve. So I think that is the operating model that has worked best for us and should work in the future.
So delivery system for the university to advance Kentucky, to do more and be more and serve more. And then I know one major project that I want to dive into, one major project now is Project Blue Connect. And so can you talk to us a little bit about what that is?
Sure. Project Blue Connect is exciting. It's an opportunity for us to really design and transform the infrastructure that we have supporting our patients across the Commonwealth. What it really is we're implementing 3 advanced softwares across the organization. Epic, which is the electronic medical record. Workday, which is the ERP, which really is the accounting system or the enterprise resource planning system for the organization. And then SailPoint, which protects us as far as our logons and our activities across the information technology platforms. And so that process right now, implementing that shared service or that shared system, will actually bring forth opportunity for us to dramatically improve our administrative and our functional capabilities and operations across the organization. The electronic medical record was implemented here at UK Healthcare in 2021. It's EPIC is what it's called. And that instance now will go across the entire healthcare enterprise. And what it does is it's going to enable our providers and our patients to be able to share their health records across the continuum of care. And that's a major thing for us as we continue to grow. We want to serve more, but also we want to serve more in the right location. So this gives us a chance to be able to have our patients move across the entire organization and still take those records with them.
That's great. I think so. Patients closest to home. So the same. Let's. Sometimes we get into these terms and all of that are a little technical, but basically, we're going to have the same computer and the same software in all the different hospitals. So we don't have that today. And so that's going to give the ability. So someone may have to come here for a transplant or something that's tertiary quaternary, but we can then reverse transfer them back to a hospital closer to home. And so that's one. 2, security. Outside of the term AI, I'm not sure there's a term we use more than security in America right now and how we think about that. So it's going to give us that component. And then we also really saw an opportunity to have this ERP and think about payroll, budget, things of that nature, HR, a human resource system that is similar for all, or the same rather, for all of these of Beyond Blue. Is that kind of in a summary? Is that
that philosophy? Really is the philosophy? And I think, when I look at it, what I really like to think is that it's the same touch and feel for every patient and every employee across the continuum of our organization. That way, we're providing that excellent service to everyone in a consistent and standard manner. I think The other thing that happens with the system is it lets us continue to grow in UK healthcare with other opportunities as we implement the Project Blue Connect, and it eliminates the dysfunction of having disparate systems. It will reduce our risk. And I think the thing that it does is there are 5 critical things and areas that it's going to add improvement to. And I think number one, we've talked a little bit about it, but it improves the clinical quality. It really will give us that opportunity to measure the results and understand those outcomes and be able to tell our story, to be honest. It gives us consistent information across the organization. I think the other thing that it does is it gives us an opportunity for greater cost efficiencies. And you think through that, it's the common platforms. You're not supporting multiple systems and multiple maintenance and reducing the licensing costs and things like that around the infrastructure that we maintain. It'll give us operational synergies. I think the one thing that's been very exciting about this is that we have learned that we all do things a little bit differently. So now with this implementation, we can take the best of all 3 worlds and incorporate it into our processes across the ERP, the electronic medical record, and all of our IT services. It will really enhance our employee and our patient experience. This is going to give us a chance to be able to have that streamlined and more efficient activity for both the patient and for the employee. And then, as you pointed out, it is going to improve our security by centralizing that activity that sometimes you don't really think about, but the provisioning and deep provisioning of employees, and also as you think about those patients as they are doing more and more online, how do you make sure you're protecting that information for them? And then ultimately for our students, as you think through everything that we do with security across our information systems.
Well said. Okay, so that's Project Blue Connect. Primary impact, Royal Blue, Claire Blue, Champions Blue, Insure Blue, I guess to some lesser extent, but that's the primary impact. And we're trying to bring those together on similar systems that become more efficient. This isn't about reducing pay or reducing the number of employees. This is about having a common platform that improves clinical care and outcomes.
Absolutely.
All right. I like that. All right. So Project Blue Connect. Now, we love our names here. So we have this other project called Integrate Blue. And I think about Integrate Blue, I think about the term shared services. And so before we get to the details of Integrate Blue, did y'all create some principles around this project? And I'd be interested to hear a little bit about those, as well as to understand how do the principles here at UK, are they similar or different than maybe others? I know we're using some consultants to help us. They've shared some stories and ways in which they're seeing this across the country. But talk a little bit about Integrate Blue. Do we have principles? What are they? And a little bit of the why.
Sure, Eric. And I think that is what makes us different in our approach. When you think through how other people look at shared services or integrated services, our guiding principles have driven us all the way along. And we are able to continue to build on those as we went through this process. But we're looking at phased implementation. So we're taking a real focused approach to make sure that we do the things that make the most sense first. So as we evaluated that, one of the things that came to the top, many people do this just for cost. That's why they do it. That was not our approach.
To save costs?
To save costs.
Okay.
Reduce expenses. That wasn't our approach. Our approach was really to think about what's nearest and dearest to us, and that's to protect our employees, our patients, and our students. So it was risk that we were really trying to look at, and how do we eliminate the risk for this organization? It's an opportunity for us to streamline our services. So use those best practices that we're learning about across all our organizations, and then come up with standard work for us to do it. It's also an opportunity when you think about how large we are and we start to build our own little, I don't know, probably wrong term is empires, but you think about how you build around one college and another college and healthcare and different organizations. You get into an organization as an employee and you don't always have an opportunity to grow. What this does is it gives ourselves opportunities to have central services, have centralized management, and give employees the experience to be able to grow within the University of Kentucky and not have to quit and go somewhere else. Really to be able to have that culture that is here, maintain it, and also to really grow that expertise of our employees as we continue to grow the organization. The other thing it does is we promised our employees that they're going to maintain their home offices, that they don't have to pick up and move, which is a great opportunity for people. They can keep their roots and be able to continue to work for the university. And then we're going to protect their compensation and their benefit structures.
So I'm an existing employee and maybe I'm in IT, or maybe I'm in marketing, or I'm in communications. I'm in Ashland. I'm in Moorhead. I'm in athletics. I'm in the College of Business. I'm in an administrative unit. I'm in UK healthcare. So I may, based on a process and review, which you're going to tell us about, be moving to a different org structure. I may be having a different line of authority and responsibility, but my comp and benefits remains the same.
Mm-hmm.
Okay, so if we then start offering and wanting to hire people that are not at the institution, will they come in with different comp and benefits? Is that possible?
I think that is part of the process we're building right now. We want to be able to offer our employees, both existing, but for sure the new employees as they come into the shared service organization, options. So we want to be able to have, we're working very closely with our HR team, Melissa Frederick, and others on how do we build a compensation and a benefit program that can be used across the entire Beyond Blue and potentially the university someday. So yes, Eric, we're trying to be very future looking and working towards those types of processes.
So we're looking at IT throughout the entire enterprise of the University of Kentucky, all 30,000 or more than 30,000 employees. We're looking at marketing, we're looking at communications. We're then going to, at some point, look at student success, or that's starting right now. Then down the road, finance, procurement, and HR, as well as have we already move forward with some of these shared services just in the last few weeks?
Yeah, we have. Effective January 1, we centralized all of our legal activities across the organization. We centralized our internal audit functions across the organization, along with the other activities around the OEO functions of the organization. And
so the Office of Equal Opportunity, yes, compliance, and security as well, around.
Absolutely. Security is coming as a next step, probably in April. But that also is a very important component to us to be able to have that consistency across the university.
We have a lot of listeners that are inside the institution, but I think we have a lot that are outside. And so I know we probably need to make sure we're speaking to all, and that before we start talking about Integrate Blue, you could have IT people throughout every component department of the institution. I think we looked at marketing and communication, and maybe we found hundreds of people doing marketing and communication across the university. So I know a corporate mind would say, wait, that's a function, a service function, a support function. It's all together. To your earlier point, over time, this has been distributed. And so we're now trying to become more efficient and bring it together because we believe we're going to have to serve and do more. So how do we have a launch pad to do that? I'm always intrigued by another thing that I know we had some interactions about, thinking about how we deploy AI, and how do we use agents and so on. And I was intrigued by a comment from one of our team members that was talking about it would be really difficult to take advantage of agents and AI because your processes you're doing 7 different things, 7 different ways to achieve the same outcome. And so this also, I think, allows us to get a foundational element to further deploy technology. Is that something that's in the horizon?
That is absolutely in the horizon. That is one of the main opportunities for us as we start to take the advantage of the synergies of centralization. So we are very focused on how do you do that? How do you get on one system? How do you get one process across the organization to take advantage of those things? And AI isn't there to eliminate jobs. It's to enhance our jobs. Sure. That's exactly what the focus will be on this, so that people can do more and we can grow incrementally without having to add the resources that we have done in the past.
So we talk a lot about outcomes and where we end, but the process is so important. And so can you walk through the process that we have done? Let's just look at IT first for an example. Can you kind of walk through what we did and kind of the multi-step and where we stand and what's in front of us?
Sure. So we actually went through a process that was assisted by a consultant where we came up with a series of questions. And we started at the ground level. We went to the individual, to the employee, and we sent them a survey and we asked, what do you do in your daily job? Help us account for 100% of what your work is. And so the employee had the opportunity to really go through and check some boxes, but they also had a narrative opportunity to say, this is really what my job is. So some of them came back 1 page long, some came back 20 pages long. But it gave us the information so that we could start to dig in and actually do the analytics around it. We opened up the whole process, though, by having open communications with the colleges and with the business unit leaders saying, this is the process we're going to go through, and you will be a part of this. You're going to be a partner. They have to be. And so we opened up those conversations with them. When the data came back from the employee, we wanted to verify it. So we brought that information back to the leaders, the business leaders, the deans, the business units, and we asked them, help us review it. Is it valid? Are there areas that we're missing? And they had that opportunity to go through and really help us scrub the data. From there, then, we took it and were able to say, okay, let's start to look at the individuals. And we know some people, let's use a Marcom person as an example in a college. They may do 50% of their job as Marcom, but the other 50% is doing something else to support that college activity. Well, we can't move all of that out of that college and the college be successful. So we're now working through the process of saying, if they weren't 100% to move, what do you do with that fractional employee, and how do you rebuild that within the college or the business unit? And so as this morning, I spent time with our deans talking about the process. They're going to see a list of the individuals that will be a part of the opportunity for centralization. There's 4 buckets: absolutely move, fractional, and the fraction is higher on the side of centralization, so 75% Marcom and 25% college. The reverse of that, where it's 75% college, 25% Marcoms. And then there are individuals that once we reviewed it, they just shouldn't move.
So is it the first 2 that likely move, or what do y'all think?
It is the first 2 that will likely move as we go through this process. There might be portions of the last, but it is the first 2.
All right. So, Craig, enjoyed this conversation. I think you've really given the listeners an opportunity to dig deeper into Beyond Blue and kind of peel back some of the understanding of that. Zeroing in on Integrate Blue, at the end of the day, what's the why or the purpose? What's the end in mind?
The end in mind, to me, is really for the success of the University of Kentucky. This is protecting our base. I mean, this will let us do more, be more. It really supports our goals of really the building the infrastructure that can support this strong university and what we do to serve the people of the Commonwealth. So,
and last question as we wrap up, and I'll share an email address here in a moment to get your feedback. If there was one thing or a couple things you wanted our listeners to take away about what is Beyond Blue, not Integrate Blue, not Project Blue, Connect. Let's go to the top. There's a couple takeaways about Beyond Blue. What would those be?
I think that Beyond Blue is here to serve. It's here to serve the university. It's here to serve our patients. It's here to serve our students and the citizens of the Commonwealth. That's what we're here for. Our business may change, as you pointed out. We may want to do more that's outside of academics or outside of healthcare, but we want to be the place that people come to and want to work with Beyond Blue and make sure that we have a successful organization and a successful outcome.
That's awesome, Craig. I am now in my 30th year, believe it or not, and I think about Beyond Blue as mission directed and oriented, to your point. But what I love most about it is that it is a component part of the institution, reporting to a president, reports to a board. And so much of my career, I see so many institutions that create 501c3 shells that are outside the institution, or private foundations that don't have the same transparency or the ability to understand. Now, we have to do a better job, I think, of communicating what it is. But once you understand it, and once we continue to communicate it about it, that being a component part tied to the mission, tied to the board, directly within the institution, I think is that foundational element of success. So appreciate you being here today. Is there any final comments, Craig, as we wrap up?
I just am honored to be a part of this process, and I enjoy every day that I come to work here. You keep me challenged all the time, Eric. So I appreciate that.
Well,
Thank you.
You're awesome, Craig, and what you do for the university. We're wrapping up the business of UK here. Eric Monday kind of signing off. We had Craig Collins with us today, the CEO of Beyond Blue, the Senior Vice President, CFO of UK Healthcare. We want to hear more about and more from you about the Business of UK podcast series. We have an email address, businessofuk@uky.edu. Please let us know, and we'll read those things and help shape the future of this podcast series. Have a great day.
Thanks for listening to Behind the Blue. Behind the Blue is a production of the University of Kentucky. For more stories about how the University of Kentucky is advancing our Commonwealth, visit uknow.uky.edu.